My dear students, and welcome back to the English online class. In the previous video, I have taken a quick feedback of the chapter which we were doing before your pre-midterm exam, and I hope that I have succeeded in bringing back into your memories what we people have done before we people got busy with the pre-midterm examination. Now, I would like to continue this chapter. I'm not going to take any feedback because I have done it already in the previous video. And as we people know that in this, just in short, I can say that it is about one Japanese doctor, Dr. Sadao Hockey, and an American prisoner of war, whom Dr. Sadao happens to come across when that man was washed ashore, and he was in a very wounded state, and doctor being a doctor, he could not resist himself from helping him out, and he brought him out instead of the fact that it was totally wrong on the part of him as a Japanese, because Japan and America, they were two hostile countries at that particular moment, and it was like harboring an enemy at home. It was something not going to be welcomed by any of them, especially the servants, those who were working in his house. But still, keeping all those things away and fighting with his dilemma between humanity as his duty of as a doctor and patriotism, he brought the man to his house along with his wife Hannah. And then it was next step was to inform the servants and cleaning the man, for which Hannah, she thought of asking the governess, or the, you can say, the nanny who was looking after their children. Her name was Yumi, but when she was took there, she refused to clean the man, and also the servants were not very happy with the fact that their master has brought this white man home. So when the lady declined and denied to wash this man, to clean him up, Hannah, out of her own anger and all, she just cleaned the man, and after her anger subsided, she started feeling like as if though she wanted to get rid of this man at the earliest, and she was feeling little uncomfortable. And then Sadao entered over there with his surgeon coat and the surgeon kit, with full intention of getting him operated, because he knew that if it is not, then the man will die. And then he ordered Hannah to fetch some towels, which she was doing obediently. Let's continue from here onwards. She went obediently, but how anxious now, to the linen shelves and took out the towels. There ought also to be old pieces of matting, so that the blood would not ruin the fine floor covering. She went out to the black veranda, where the gardener kept strips of matting with which to protect delicate shrubs on cold nights, and took an armful of them. But when she went back into the room, she saw this was useless. The blood had already soaked through the packing in the man's wound, and had ruined the mat under him. "Oh, the mat," she cried. "Yes, it is ruined," Sadao replied, as though he did not care. "Help me to turn him," he commanded her. Okay, when her husband, Dr. Sadao, he asked her to fetch some towels, she acted obediently, and she went near the linen shelves to fetch some towels. And then immediately she remembered that there were certain pieces of matting, means maybe some kind of a plastic mat or something, which she would like to put under him, so that the blood coming out from the man will not ruin the floor covering. So she went out to the back veranda to fetch some. She knew that the gardener is keeping it over there, so that in the cold season he can cover the shrubs to protect them from the cold. And then she picked up an armful of it and came inside. When she went back into the room, she found that it was useless. You know why? Because the blood had already came out from the packing. You remember that packing which I said, that sea moss packing which Dr. Sadao put so that temporarily he could stop the bleeding? Yes, that one. From that, already the blood has come out, and it has ruined the mat under him. She, as the lady of the house, she just cried, means out of sadness, she said, "Oh, my mat." Then Sadao, he's a total, you can say that he was a very dedicated doctor. So because of that reason, he said, yeah, it's ruined. And his sound didn't felt like as if though it mattered him any more, because for him the patient was more important. And then he commanded to his wife that turn the man, help me to turn the man. She obeyed him without a word, and he began to wash the man's back carefully. Yumi would not wash him, she said. Did you wash him then? Sadao asked, not stopping for a moment his swift, concise movements. Yes, she said. He did not seem to hear her, but she was used to this absorption when he was at work. She wondered for a moment if it mattered to him what was the body upon which he worked so long as it was for the work he did so excellently. You will have to give the anesthetic if he needs it, he said. I? She repeated blankly. But never have I. It is easy enough, he said impatiently. Okay, now basically we people have seen that she was like an assistant for him, and he asked her to help him to turn him. And after he had turned, she said, she just didn't say anything at that time, and he started cleaning the man very carefully, back of that man very carefully, because the bullet was at the lower right hand side back, no, right side back. And then she said to him, means she was informing him that Yumi had not washed him. She declined to wash. She denied to do so. Then Sadao, without moving or without stopping even for a moment what he was doing, he asked, you washed him then? And he was doing his work with very concise movements. Concise movements means like very calculatively. Means he knew that what he was doing, and so nicely he was doing his work, and he did not even stop it. While doing, he asked her, and then she said, yes, I did it. But it looked like as if he did not even hear her. And then Hannah didn't feel bad, because she was used to this kind of his absorption in his work. Whenever he gets into his work, she thinks that he fully gets immersed into it, and he is not bothered what is happening around. And for a moment, even it came into her mind whether he ever bother on whose body he is working out on. He is more bothered about doing it successfully and perfectly. Then he said to her something that was totally like a shock and a surprise for her. He said that you need to give him anesthesia. She was totally shocked, because she had never done it. So she said, but I have never given anyone anesthesia ever before. Then he said impatiently, the man seems to be a little impatient when it comes to perfection and all. He said, it's very easy, nothing you have to do. Then he was taking out the packing now, and the blood began to flow more quickly. He peered into the wound with the bright surgeon's light fastened on his forehead. The bullet is still there, he said with cool interest. Now I wonder how deep this rock wound is. If it is not too deep, it may be that I can get the bullet, but the bleeding is not superficial. He has lost much blood. Okay, that packing which I spoke about right now also, that green color moss packing which he had put over there from the side of the beach to stop the bleeding, he took out that. And the moment he took out that, more blood started coming out. And then he peered into the wound. He looked into the wound through the light which was there on his forehead. You can see the picture. In those days, even now also you would have seen that in the coal mines and all, people use helmet with the light over there on that. Okay, not that kind, but little different. On the forehead, as you can see, there is one kind of light over there. That with the help of that light, he was looking into the inside the wound, and he said that the bullet is still there. And he said that if the bullet is still there, I am really wondering how deeply the rock might have wounded this man. If the wound is not too deep, I can take out the bullet. But the problem is that the bleeding is not stopping, which tells me that the wound is deep, as well as he has lost a lot of blood as well. Further, at this moment, Hannah choked. He looked up and saw her face the color of sulfur. Don't faint, he said sharply. He did not put down his exploring instrument. If I stop now, the man will surely die. She clapped her hands to her mouth. and leaped up and ran out of the room. Outside in the garden, he heard her retching, but he went on with his work. It will be better for her to empty her stomach, he thought. He had forgotten that, of course, she had never seen an operation, but her distress and his inability to go to her at once made him impatient and irritable with this man who lay like dead under his knife. Okay, while he was talking about all those things, at that time, what happened? Hannah was standing there, and this man he was a doctor. Doctors are very casual with and normal with all these circumstances, but other humans it's very difficult. He has taken out the patch, and then the blood had started coming out from there. Then suddenly he felt that Hannah is choking, and then he looked up and he saw that her face was that of color of sulfur, pale yellow, that kind of color it was. And then he said to her, please don't faint, behosh mat hona. And then he did not put down his instrument. He said that if I'll stop now, this man will die. And then what she did, she clapped. Clapped means like keeping both the hands, like when you feel vomiting, how you do now, you just cover up your mouth with your hand. In the same way, she clapped her hands to her mouth and she ran outside. She leaped. She ran outside of the room. Then after a few seconds, he could hear her retching. Means when someone vomits, that noise comes, now vomiting time. That retching noise he could see. But he continued with his work. Then he spoke to himself and he said, he thought that it will be better if she empty her stomach. Yeah, because what an operation going on, and she's not comfortable with that situation, because she had attended an operation. So because of that reason, he thought that it is better that she empty her stomach. And then basically in his own flow of work, he forgot that she had never attended any operation. So he was feeling irritable in the sense that her wife was in pain in the sense that she was uncomfortable, she was vomiting, she was feeling like falling down unconscious, and there he was unable to go to her to console her. And this was making him impatient and irritable, especially with that man who was lying like half dead under his knife. Knife means not kitchen knife I'm talking about the surgical knife. This man, he thought, there is no reason under heaven why he should live. Unconsciously, this thought made him ruthless, and he proceeded swiftly. In his dream, the man mourned about, but Sadao paid no heed except to mutter at him. Now, while he was doing his work, he was thinking that, I don't know why this man wants to live, or why he should live. Reason is there, even if he succeed in his operation and this man live, he will be handed over to the police. And when he will be handed over, he is a prisoner of war. Then God only knows what torture he has to suffer. With. So because of that reason, he said that why he should live, I don't know. And unconsciously, this thought made him little ruthless. Ruthless means little brutal. And he started doing the work more fast. The man was unconscious, lying down there. He mourned, means like when you make noise out of pain. But Sadao paid no heed, no attention to it, except muttering to him. Means like grumbling or mumbling something, talking something, which is not clear. Then what he muttered, you see. Groan, he muttered. Groan if you like. I'm not doing this for my own pleasure. In fact, I do not know why I am doing it. Really, it is a very difficult task when a man is in a dilemma. Means he's standing on a place where he has to make a choice between two, and it's really very difficult. One place his nation is there, another place his profession is there, his duty towards humanity. So when the man mourned, he made noise out of pain. He said that, groan, make noise. How much you want, you make noise. I am not doing all these things for my pleasure. Means Dr. Sada is talking to that unconscious man. He's saying that it's not for my pleasure I'm doing all those things. Basically, I don't even know why I'm doing it. And then the door opened and there was Hannah again. Where is the anesthetic? She asked in a clear voice. Sadao motioned with his chin. It is as well that you came back, he said. This fellow is beginning to stir. She had the bottle and some cotton in her hand. But how shall I do it? She asked. Simply saturate the cotton and hold it near his nostrils. Sadao replied without delaying for one moment to intricate details of his work. When he breathes badly, move it away a little. Now, here, while he was talking to that unconscious man, at that time the door opened and then she came inside. Means Hannah came inside, and she seems to be much more balanced now. And she said, "Where is the anesthetic?" See, in today's time, what happens is that an anesthetic comes and he gives the anesthesia. But in those days, they used to have that liquid through which they used to give it through the nostril to the people. They used to make them unconscious. You know what is anesthetic? I hope so. Anesthesia, you know what it is. Anesthetic, you know what it is. Means to make senseless. You might be knowing about it. And then she said where it is. So Sadao, instead of talking, he motioned with his chin. Means like he lifted his chin towards one shelf side, showing the direction through his chin. And then he said that it is nice that you came back, because this fellow is started regaining his conscious. He began to stir, means began to move. So she came with the bottle and some cotton in her hand. Then she asked, what I'm supposed to do with this? The poor one, she don't know how to use it. So she asked that what I'm supposed to do with this. Then he said that do one thing, simply saturate the cotton. You know what is saturating the cotton? I hope so. Saturate means soaking it or making the cotton wet with that medicine, the anesthetic. Okay, and then hold that cotton near his nostrils. And he also said he was just busy with the intricate detail of his work. Intricate means the complexity of the work, the seriousness of his work. And then he said that if he breathes badly, means if he takes long breath, then you just move that cotton for a little. Okay. Now, she crouched close to the sleeping face of the young American. It was a piteously thin face, she thought, and the lips were twisted. The man was suffering, whether he knew it or not. Watching him, she wondered if the stories they heard sometimes of the sufferings of prisoners were true. They came like flickers of rumors told by word of mouth and always contradicted. In the newspapers, the reports were always that wherever the Japanese armies went, the people received them gladly, with cries of joy at their liberation. But sometimes she remembered such men as General Takima, who at home beat his wife cruelly, though no one mentioned it now that he had fought so victorious a battle in Manchuria. If a man like that could be so cruel to a woman in his power, would he not be cruel to one like this, for instance? This para is reflecting the thoughts of Hannah over the tortures done towards the warriors or the soldiers of war. See, my dear students, first of all, the first line I would like to explain, she just crouched close. Crouched close means like if someone is lying down and you just jump and fold your leg and sit down next to that person, that is called as crouching. And then she went near and sat down near the sleeping face of the young American fellow, and then she looked at his thin face and she started thinking, my God, how much this man might have suffered. God knows, because she had heard a lot of rumors about what goes on upon the prisoners, and she knew that generally, basically in the places, and we know that how brutal the Japanese, the Germans and all those people are with the prisoners of war. So But she was also having doubt because there was some contradictory, means totally opposite news also about how beautifully, how lovingly the army of Japan is received by many of the places because of the liberty that had been raised by them or that had been achieved by them. And then the next moment she thinks about someone like General Takima. This Takima is the same general I am talking about who had stopped Dr. Sadao from going out for his own personal reasons. And this man, General Takima, he beats his wife very cruelly. So she started thinking, a man, though he is appreciated for all the victorious battle he has won, if he could be very cruel to a lady, how cruel he might be to a prisoner of war when it is under his power. She hoped anxiously that this young man had not been tortured. It was at this moment that she observed deep red scars on his neck, just under the ear. Those scars, she murmured, lifting her eyes to Sadao. But he did not answer. At this moment, he felt the tip of his instrument strike against something hard, dangerously near the kidney. All thought left him. He felt only the purest pleasure. He probed with his fingers, delicately, familiar with every atom of this human body. His old American professor of anatomy had seen to that knowledge. Ignorance of the human body is the surgeon's cardinal sin. Sirs, he had thundered at his classes year after year, to operate without as complete knowledge of the body as if you had made it. Anything less than that is murder. I love this paragraph, my dear students. Very beautifully, the work of a doctor and the need of a doctor to be a doctor is been explained over here. See, my bio students, pay attention. Here, while she was just thinking over the tortures and all, suddenly she saw that she was anxious to know that whether this young man has also passed through the same. And suddenly, just under the ear, she found some red scars. You know what is scar? When you are hit badly or something of that, a mark of the wound comes. That is called a scar. So there were deep red scars under the ear. She just said slowly, murmured, lifting her eyes to Sadao, those scars. But where Dr. Sadao is listening, he did not answer. At that particular moment, he felt that his instrument, the surgical instrument with which he was peering or probing into that wound, he felt like it struck something against something hard. You can understand what that hard material could be. Bullet. And it was somewhere near the kidney. Everything left him, all the thoughts. Now see this line. He felt only the purest pleasure. My dear students, don't think that he found the man wounded, that was pleasure, or he was operating the man, that was pleasure. It was the pleasure of finding the bullet. That is what is purest pleasure. Then he probed with his fingers, means he examined with his fingers very delicately, and like as if though he is familiar with every part, every atom of this human body. He says his old American professor of anatomy had seen to that knowledge. You know the meaning of that line? You remember I told him he went to America for studying surgery at the age of 22, and at the age of 30 he returned back. These 8 years when he had studied there, his anatomy professor, anatomy means dealing with the internal organs, okay? His anatomy professor had made sure that the students who have come there to learn surgery, they must know each and every part, location, everything of a human body. And he says in every class, year after year, he used to thunder. Thunder means he used to shout and tell the students that, I'm reading it again, ignorance of the human body is the surgeon's cardinal sin. Means that for a surgeon, if a surgeon is not having, or if a surgeon is ignorant, is not having a proper knowledge of human body, then it is a grave, serious mistake. And he said, another line you see, very beautiful. To operate without as complete knowledge of the body as if you had made it. Anything less than that is mental. Means when a patient goes to an operation theatre and when a surgeon is operating on that man, on that patient, it should be with a complete knowledge. Means it should be like as if though that patient body is being created by that surgeon itself. Because if you don't have complete knowledge of the various organs, its placement, etc., etc., in the operation theatre, you are not performing an operation, but instead of that, you are doing a murder. I hope that is clear to you people. And then further he said, it's not quite at the kidney, my friend, Sadao murmured. It was his habit to murmur to the patient when he forgot himself in an operation. My friend, he always called his patients. And so now he did, forgetting that this was his enemy. Our Dr. Sadao is having one habit, that when he gets lost in his work and he's doing his operation and all, and to make the patient comfortable, he calls them my friend. So in his flow of work, he forgot that the man lying right front of him, under his knife, under his fingers, was his enemy. And he said to him, it's not that quite at the kidney, my friend. Means he's consoling him that need not worry, it is not that quite near to the kidney, my dear friend. Then quickly, with the cleanest and most precise of incisions, the bullet was out. The man quivered, but he was still unconscious. Nevertheless, he muttered a few English words. Guts, he muttered, choking. They got my guts, Sadao, Hannah cried sharply. Shh, Sadao said. Then, after Sadao has found that it was not quite at the kidney, an excellent doctor, a famous surgeon, with a very clean and most precise of incision, means very perfectly at the perfect place in a perfect manner, he made a cut and the bullet was out. The man, he quivered, means he trembled, she shook out of pain, but he was still unconscious. But he muttered something in English. He said, guts. Guts, you all know what are guts, I hope so. Interesting. So he said, they got my guts, they got my guts. Maybe he might be remembering the bullet shot towards him. And then Hannah, for her, everything is new. She said, Sadao. Means he was talking, no? So Sadao asked her to stay quiet and he said, shh. And with this, I'll bring today's video to an end and we'll continue with the rest in the next video. Till then, take care and goodbye.